The fluorescent lights buzz overhead like trapped wasps, a sound Hannah Clarke has learned to filter out the way soldiers learn to ignore artillery fire in the distance. 2:47 in the morning. St. Michael's ER in Raleigh runs on a skeleton crew at this hour: nurses, orderlies, one attending physician who spends most of his shift staring at his phone. Hannah moves through the medication supply room with the kind of practiced invisibility that comes from 6 months of making herself small, quiet, forgettable. Her hands move with surgical precision, each vial sorted, each syringe counted, each notation logged in a rhythm that could be timed with a metronome. The overhead fluorescents cast her face in a hard institutional white that makes her look like a ghost moving through the corridors. She wears long sleeves despite the oppressive heat that never fully leaves the hospital, not even at midnight. The sleeves cover rope burn scars on her forearms, thin pale lines that tell a story she will never volunteer. The ER smells of antiseptic and floor wax tonight, that familiar chemical bouquet that masks everything underneath: blood and fear and the particular desperation of 3 in the morning. Hannah reaches for the chest tube kits on the third shelf, her fingers moving across the packaging with a precision that betrays something. The way she checks the seal. The way she assesses the angle of insertion on the instruction card without reading it. The way her eyes track the anatomical placement diagram like muscle memory moving through her hands. Tommy Rodriguez, 63 years old, former Army combat medic turned hospital transport worker, has been watching her for exactly 47 seconds from the doorway without her knowledge. His own hands tell him things: hands that held intestines back into a Marine's abdomen in Fallujah, hands that started 3 emergency transfusions with nothing but field expedient knowledge and the absolute certainty that stopping meant death. He recognizes the way she inventories those chest tubes like she has placed them before. Not theoretically. Not textbook. Placed them under fire, probably. Placed them with someone's life emptying out in front of her and no time for second guessing. "You're thorough," Tommy says quietly, and Hannah doesn't flinch. That's the first thing that tells him he was right. A regular nurse would have startled. Hannah simply turns, her face already composed, her breathing unchanged. She doesn't flinch at loud noises anymore because loud noises stopped meaning danger about 4 years ago, when she learned that the sound trying to kill you and the sound of a metal cart dropping in the hallway register in completely different parts of your brain if you train it right. "Standard procedure," Hannah says, her voice pitched low and even. She returns to the cabinet without waiting for a response, though they both know that standard procedure does not require checking the sterility seal on equipment that comes pre-sterilized from the manufacturer. Standard procedure does not require memorizing the placement guidelines on a chest tube kit that any ER nurse will only place maybe 3 times in a career. Tommy watches her hands finish the count: 72 kits, all accounted for, and he sees the faded rope burn scars flex when she closes the cabinet. He sees the surgical calluses on her palms from places that don't exist on any nursing credential he has ever seen. "You served," Tommy says. It is not a question. It is a statement delivered with the certainty of a man who has spent 42 years recognizing his own kind, recognizing the way certain people move through the world like they are always assessing threat angles and exit routes. Hannah turns to face him, and her eyes meet his for the first time, and in that moment Tommy Rodriguez understands that she knows he knows, and that she is calculating whether this matters. Whether he represents a threat to the careful anonymity she has constructed like armor around herself. "I don't know what you mean," Hannah says finally. Her voice has not changed. Her posture has not changed. She is lying with the same flawless composure that soldiers learn when lying has kept them alive. Tommy simply nods, understanding that the conversation has ended, understanding that some conversations end without any words being said at all. He moves aside to let her pass, and as she walks back toward the ER, he sees the way her shoulders remain perfectly still, the way her gait changes when she thinks no one is watching, becomes somehow lighter, more economical, the walk of someone who has carried 100 pounds of tactical gear across desert terrain in 118-degree heat. Hannah returns to the main ER corridor at 2:51 in the morning, and she does not notice Dr. Pierce watching her from the physician's lounge doorway with the intensity of a man cataloguing evidence for a case that has not yet been filed. Pierce is 47, the kind of handsome that comes with privilege and certainty, with a jawline that could cut glass and eyes that move across Hannah like she is a clinical specimen under examination. He has been at St. Michael's for 3.5 years, long enough to build political alliances with the hospital board, short enough that he still hungers for something, more respect, more authority, more deference than even his title provides. He watches Hannah adjust the central monitoring station, her hands moving with an economy of motion that most nurses do not possess. Most nurses fumble. Most nurses check their work twice. Hannah touches the screen once, makes one adjustment, confirms one reading, and moves to the next task. She moves like someone who has already learned that hesitation is the enemy. Pierce makes a mental note of this. He makes a mental note of everything, the way she avoids eye contact with the attendings, the way she never joins the break room conversations, the way she somehow answers patient call lights before they light up on the system, as if she can sense need, the way trauma surgeons sense hemorrhage. He makes a note of the long sleeves despite the heat. He makes a note of the fact that she never discusses her background, never mentions a family, never once participates in the casual exchange of personal details that builds the social fabric of the ER. She is a ghost. A competent ghost, which is somehow worse than an incompetent one, because competence without deference is its own form of rebellion. At 3:14 in the morning, a 68-year-old male arrives with chest pain, and Hannah is already moving toward Trauma Bay 3 before the EMS radio finishes the report. The patient, Marcus Webb, hypertensive, diabetic, overweight, probably going to code before sunrise, needs a 12-lead EKG, needs blood labs, needs a troponin serial. Hannah has the EKG machine positioned before the patient is fully transferred to the hospital bed. She has the leads placed with a speed that makes it look effortless, her fingers moving across his chest with the kind of gentle certainty that puts a frightened man at ease. She reads the tracing before the machine finishes printing, and her eyes catch on something, a subtle ST elevation that the EKG machine will not highlight for another 10 seconds, and she is already radioing for the cardiology consult that the attending will not order for another 3 minutes. The attending, a young internal medicine resident named Dr. Sarah Chen, glances at the EKG after Hannah's call. ST elevation, Chen confirms, her voice carrying the surprise of being beaten to a diagnosis by a nurse. She orders the troponin serial, orders the heparin protocol, and Hannah is already hanging the 4 bag, already running the labs, already operating on a timeline that exists in her mind before it exists on any written protocol. She moves with the grace of someone who has triaged trauma in a forward operating base where the difference between quick hands and slow hands was the difference between someone going home and someone not going home at all. Dr. Pierce watches this from the doorway, his expression hardening into something that looks like calculation. She is good. Dangerously good. Good enough that someone might notice. Good enough that someone might ask questions about where that competence comes from. Hannah finishes her assessment of Marcus Webb and steps back, her hands coming to rest at her sides, her face revealing nothing. She has learned to show exactly nothing when she is thinking, because the cost of exposing your mind in a place like this is higher than most people understand. In the break room at 3:47, she sits alone with a cup of coffee that has gone cold while she was working, and Jennifer Morse, one of the day's shift nurses who came in early, sits down across from her with the kind of deliberate friendliness that makes Hannah's shoulders tighten by 1 millimeter. "You're really good at your job," Jennifer says, and it is meant as a compliment, but it feels like a question. It feels like Jennifer is trying to establish a connection, trying to pull Hannah into the casual intimacy that binds hospital staff together. Hannah has learned that this is dangerous. Connections require explanations. Explanations require consistency. Consistency over time creates patterns, and patterns can be investigated. "Just following protocol," Hannah replies, and she takes a sip of the cold coffee without flinching, without reacting to the bitter taste of 8 hours of oxidation. "You definitely don't just follow protocol though," Jennifer says, leaning forward with the kind of sincere interest that Hannah has learned to recognize as a trap. "I watched you with that trauma last week. You caught something the attending missed. Where did you train? I don't think I've ever seen it on your file." Hannah sets the coffee down with a kind of careful precision that someone uses when they are controlling their own impulses. She has learned to control her impulses very thoroughly. "Community college program," she says flatly. Nothing special. It is not quite a lie. She did complete a community college nursing program, though this was after the other degree, after the other training, after the years that do not appear on any official record. The years in Tikrit. The years in forward operating bases. The years that made her capable of things that civilian nurses are trained not to need. Well, you're being wasted on night shift, Jennifer says, and there is something in her voice that sounds like genuine concern, and that is the worst kind, because genuine concern can lead to genuine questions, and genuine questions can lead to investigations, and investigations can lead to names being checked against databases that explicitly state she is supposed to be dead. I prefer nights, Hannah says, and this is true. Nights are quieter. Nights have fewer supervisors. Nights have fewer people asking questions about credentials and backgrounds and the nature of the gaps in employment history. She finishes the cold coffee and stands, and her movement is smooth enough that Jennifer takes it as a signal to stop talking. This is what Hannah has learned over 6 months at St. Michael's, how to communicate without words. How to set boundaries with her body, with her eyes, with a careful absence of any emotional response to casual friendship. At 4:12 in the morning, Marcus web codes. His heart rate drops into the dangerous zone, his oxygen saturation follows, and the monitor begins its panic beeping that sounds like an electronic scream. Hannah is in the room before the code blue can be fully announced. She already has the crash cart positioned. She is already running the first round of medications. She is already assessing blood flow, assessing response, moving with a fluidity that makes the emergency feel less like chaos and more like choreography. The attending arrives, the residents arrive, the full team assembles, but Hannah has already established the rhythm, CPR at 100 compressions per minute, medication every 4 minutes, reassessment that follows the guidelines but also something deeper, something that comes from having read dozens of dying people and learning the pattern of how a body moves from salvageable to gone. They bring him back at 4:19. Sinus rhythm returns like a gift. His oxygen saturation climbs from 58 to 72 to 85. Hannah steps back and lets the team stabilize him, lets the attending make the decisions, returns herself to the role of competent ghost executing orders. But Dr. Pierce, watching from the corner of the trauma bay, has seen something. He has seen that Hannah Clarke moved with the certainty of someone who has done this before. Not in a classroom. Not in simulation. In the field. In the rain. In the dark. In the kind of places where the wrong move kills someone and the next patient does not wait for you to process your emotions about the previous one. And that, Dr. Pierce decides, is a problem that requires his attention. The Morrison family clustered around their father's bed like mourners at a funeral, though James Morrison was still breathing, or barely. Hannah had been watching his oxygen saturation creep downward for the last 20 minutes, and the chest x-ray she'd ordered herself showed what the family couldn't see, the air pocket pressing against his right lung, collapsing it slowly, methodically, like a fist closing. Tension pneumothorax. She was explaining this to them, pointing at the radiograph with steady fingers, when Dr. Pierce walked in. He didn't announce himself. He simply appeared in the doorway like something that had solidified out of anger, and his voice came out smooth as surgical steel. Nurse Clarke, a word. Now. She excused herself and stepped into the hallway. Before she could speak, he turned back to the family with a practiced smile, the kind that made his face a mask of concerned authority. I apologize for my nurse's dangerously presumptuous diagnosis. She's shown a troubling pattern of exceeding her training. He was loud enough that Hannah could hear every word from the corridor. We have protocols for a reason. Nurses who think their doctors get patients killed. Hannah's jaw tightened. Just a fraction. No one else would have seen it, that microscopic shift in bone structure, the way her teeth pressed together for exactly 1 second before releasing. She stood perfectly still, arms at her sides, and waited 2 beats of silence. Her voice came out flat and cold, the kind of flat that made the fluorescent lights overhead seem suddenly too bright. I identified it 40 minutes before your X-ray order, doctor. The patient is breathing because I acted. She walked past him back into the room without waiting for a response. Behind her, she heard him start to speak, that kind of insubordination, but his voice trailed off, lost in the mechanical wheeze of the ventilator and the steady beep of the cardiac monitor. The Morrison family stared at her with something that might have been gratitude and might have been fear. She didn't read faces anymore. Faces were distractions. By lunch, the message had spread through St. Michael's like a virus through unvaccinated wards. The break room was her usual refuge, the one place in the hospital where she could eat in silence while the world churned on without her. She pushed through the door at 1,247 hours, unwrapped her sandwich, and sat at the corner table where she always sat. A plastic container of rice and grilled chicken. Nothing that required conversation. Within 15 seconds, a surgical resident stood up and left. 30 seconds later, 2 nurses from the orthopedic unit grabbed their yogurts and followed. A third RN, someone Hannah had covered shifts for twice, looked at her directly, then looked away, and walked out. The room entered like air from a tire, slow, inevitable, complete. Through the break room window, Hannah watched them cluster in the hallway outside, their heads bent together in whispered conversation. Staff had learned the calculus of self-preservation. Association with Hannah Clarke drew Dr. Pierce's scrutiny. Scrutiny meant write-ups. Write-ups meant lost bonuses, shifted schedules, recommendations withheld for promotions that should have been automatic. The only person who stayed was Tommy Rodriguez. Old Tommy, the former Army combat medic who'd moved into patient transport 2 years ago and never complained about the pay cut. He sat across from her in the empty break room, methodically eating his sandwich, his presence a kind of quiet testimony that Hannah tried not to interpret as kindness. Kindness was a liability. She nodded at him. He nodded back. They ate in silence. The fluorescent lights hummed their familiar tune, a low electrical drone that Hannah had learned to filter out months ago, but it suddenly seemed louder in the empty room, like the lights themselves were disapproving. She finished her lunch, rinsed her container, and walked out to check on James Morrison. His oxygen saturation was already improving. The pneumothorax was responding. By evening, he'd be asking for his daughter. But that wasn't the worst part. At 1,643 hours, Dr. Pierce posted the formal write-up on the unit bulletin board in the main nurses' station, the place where every staff member, contractor, and volunteer would see it before their shift ended. It was printed on official letterhead and signed with a physician's authority that made the paper itself feel like a weapon. Hannah read it while her hands steadied themselves on the counter, written warning, RN Hannah Clarke, exceeding scope of practice, emergency chest tube placement without physician authorization. RN Clarke dangerously inserted a 28 French chest tube under emergency protocol without appropriate physician oversight. Pattern of reckless behavior consistent with scope creep and dangerous autonomy. Recommend supervisory review. He dated it 3 weeks ago. Backdated it. Staff members gathered like iron filings around a magnet, pulling close to read the accusation, then moving away quickly, afraid the shame might be contagious. Hannah approached the board calmly. Her eyes scanned the words with the same attention she'd scanned vital signs, clinical, detached, absorbing data without emotion. Dr. Pierce was watching from the nurse's station, his posture a portrait of righteous authority. She turned to him. Her voice came out exactly level, exactly precise, the kind of precision that comes from military bearing and years of not flinching. I've closed more chest cavities than you've opened, Doctor. But sure. Let's discuss scope. Then she walked away. The room didn't go silent. Rooms didn't have that kind of respect anymore. Instead, there was that particular quality of sound that happens after someone has said something that can't be unsaid. The coffee machine seemed to run louder, someone's pager beeped as if on cue, and Dr. Pierce's voice came after her, loud enough for everyone to hear. That attitude is exactly why nurses like you are dangerous, clipboard. Exactly why we need hierarchy. The nickname spread within hours. Clipboard. It was meant to demean, suggesting she clung to protocols and boxes and forms instead of understanding medicine the way a real professional should. By the end of shift, she'd heard it whispered 3 times. By the next morning, she'd heard it 7. The chaos began at 08 for 7 the following Tuesday. A multi-car accident on Interstate 40 just outside Raleigh brought the ER to critical capacity. The ambulance radio crackled with urgent tones, multiple casualties, ETA 8 minutes, code yellow, prepare trauma bays 1 and 2. The automated alert system blared overhead, summoning neurosurgery and orthopedics and the general trauma team. Hannah was already moving, her hands pulling on fresh gloves, her mind shifting into the specific clarity that came from triage protocol. The first ambulance arrived with a woman whose femur was shattered. The second brought a teenager with a laceration across the abdomen. The third brought a man with no identification, no family, no context, just a body with massive internal injuries and a wallet that had been lost somewhere between the crash site and the ambulance. A John Doe. Mid-40s, maybe, though trauma had a way of aging faces. Deep lacerations across both arms. Abdominal distension suggesting internal bleeding. Glasgow coma scale of 8. Dr. Pierce assigned the John Doe to Hannah with a smile that wasn't a smile. Since you're so confident in your abilities, clipboard, this is your patient. Every complication will be documented. She didn't respond. She simply turned to the stretcher and began her assessment, peeling away the torn fabric of his clothes with methodical precision. Her eyes moved across his torso in a specific sequence, checking for exit wounds first, running her fingers along the likely trajectory, then checking for entry points, then scanning for blast patterns. It was muscle memory. It was the way someone learned to triage when they'd done it under fire. Tommy Rodriguez was helping guide the stretcher, and she saw his hand stop for half a second when he watched her work. His eyes narrowed. He knew. Or he suspected. Or he recognized something in the architecture of her movements that spoke a language only certain people could read. "You served," Tommy whispered. Just 2 words. Just that. Hannah didn't look up from the assessment. "I serve coffee and bedpans now, Tommy." But they both knew it was a lie. The John Doe crashed at 0923 hours. His heart simply stopped. One moment the monitor showed a chaotic rhythm struggling to maintain perfusion, the next moment just the flat line that meant nothing. Dr. Pierce was in the adjacent trauma bay with his own patient, and the responding physician was a resident named Chen who looked exactly like someone who'd never done manual compressions before. Hannah was moving before the monitor announced the flat line. She placed her palms on his sternum and compressed with force that would crack ribs, and she compressed with the precise rhythm that comes from having done this while rounds were coming in and the dust hadn't settled from the explosion. Compressions that didn't panic. Compressions that worked. 1 milligram epi, pushing now, Chen said, his voice climbing toward panic. Breathing? Hannah asked without stopping. No breath sounds. She kept working. The John Doe's chest rose with each compression, and she felt the ribs shift under her hands, not breaking, just protesting. His body was a machine with a stopped engine, and her hands were the temporary fuel. 20 more compressions. 30. The monitor flickered. Tachycardia. Then something that looked almost like purpose. "We have a rhythm," Chen breathed. Hannah checked for a carotid pulse. There. Weak but present. Sinus rhythm slowly emerging from the chaos, like a radio signal finding itself out of static. She looked at Tommy. He was staring at her hands. The cardiac monitor screamed its warning at 2:17 a.m. on the second floor of St. Michael's ER. Hannah didn't look up from the intake paperwork when the ambulance crew wheeled through the automatic doors with what used to be a human being. Multi-car pile-up on I-40. That's what the radio had crackled 15 minutes earlier. White sedan versus a box truck versus 3 other vehicles that had just been in the wrong place when physics decided the rules no longer applied. The man on the stretcher had no wallet, no phone, no identifying markers except the ragged hole in his left side where a seatbelt anchor had punched straight through. The paramedics called him a Jane Doe until someone corrected them, male, late 40s, probably, brown hair matted with blood that looked like crude oil in the fluorescent light. Hannah moved into the trauma bay with the automatic efficiency of someone who had done this perhaps 5,000 times. Or perhaps 5,001. The numbers blurred after a while. What mattered was the assessment: exposed ribs on the left anterior chest wall, abdominal distension suggesting internal bleeding, breath sounds diminished on both sides. The type of injury that required either a trauma surgeon in the next 4 minutes or an obituary writer by dawn. She was reaching for the trauma shears when she felt him. Not saw. Felt. The presence of someone familiar moving at combat speed through the bay. Tommy Rodriguez. The transport driver with the scarred forearms and the precise way of moving that meant he'd carried wounded men while people shot at him. He was supposed to be downstairs processing the intake forms. Instead, he was 3 feet away, watching her hands as she cut away the John Doe's shredded shirt. Watching the pattern of her assessment. The way she checked for entry and exit wounds with the efficiency of someone who'd done it under incoming fire. The way her fingers found the anatomical landmarks before her eyes confirmed them. The way her muscle memory worked in a language that had nothing to do with nursing school. Tommy leaned closer. His voice dropped below the chaos of the monitors and the 4 pumps and the attending surgeon barking orders about chest X-rays and CT imaging. "You served," he said. Not a question. An observation. The kind of thing a former Army combat medic whispers when he recognizes another medic who learned their craft in places where the classroom had mortars and the final exam was whether your patient lived through the transport. Hannah's hands didn't pause. The scissors continued their efficient work. But her breath caught for exactly 1/10 of a second, and that was enough. That tiny hesitation told Tommy everything he needed to know. She didn't answer him. She didn't have to. The way she was moving, the way her eyes scanned the wound with the kind of 3-dimensional spatial reasoning that only came from field triage, the way she already knew what equipment would be needed before the surgeon ordered it, that was answer enough. The chest X-ray came back at 3:42 a.m. Hannah reviewed it in the dimly lit corner of the ER where the night shift went to pretend they were thinking about something other than the 12 other patients in various states of decay around them. The John Doe's left lung was white. Completely white. Not inflated. Not working. Pneumothorax on top of everything else. But that wasn't what made her hands go still. That wasn't what made her reach for the patient's chart and cross-reference it against the monitor strips from the past 6 hours. The pressure was dropping. Systolic down to 86. Heart rate climbing to 118. Jugular veins distended like they were about to burst through the skin. JVD. Muffled heart sounds. The classic triad that had a name, that had a timeline, that had an outcome if nobody acted in the next window of time that was probably measured in hours rather than minutes. Cardiac tamponade. Fluid accumulating around the heart. Pressure building in the pericardium. Suffocating the organ from the outside while it tried to pump the body's blood through damaged vessels that were leaking like a sieve. The John Doe didn't have hours. He had maybe 8 if he was lucky, and his luck had already been spent on surviving the actual crash. Hannah paged Dr. Pierce at 4:03 a.m. His voice crackled back on the hospital phone system within 90 seconds, which meant he was already in the hospital somewhere. Probably in the doctor's lounge reviewing the disciplinary file he'd been building against her for the past 6 months. "His pressure is dropping," she said. Her voice was level, professional, absolutely devoid of the urgency that was screaming through her nervous system like a fire alarm. "I'm seeing classic signs of cardiac tamponade. He needs a pericardiocentesis. Now." Silence. The kind of silence that stretched out like a physical thing. His echo from this morning was clear, Pierce said finally. His voice came through the speaker with the texture of cold steel. Completely clear. "You're being paranoid, clipboard. This is exactly the kind of overreaction I've documented in your file. Continued observation. If anything changes materially, page me again." He hung up. The disconnect tone sounded like a door closing on a cell. Hannah stood in the corner of the ER holding the phone receiver like it might transform into something useful if she waited long enough. Around her, the hospital moved through its nocturnal rhythms. The 4 pumps beat their steady mechanical heartbeats. Somewhere in Trauma Bay 2, a patient with a compound femur fracture was screaming soft, broken sounds that meant the morphine was wearing off. The ventilator in Bay 3 wheezed its rubber hose rhythm. She called the cardiothoracic surgery resident directly at 4:09 a.m. "Need a stat consult in the ER," she said. "Penetrating thoracic trauma, acute pericardial effusion, hemodynamic compromise." "Yeah, sure, I'll be down in a few," the resident said. 17 minutes later, Hannah's pager chirped. The message was simple: disregard that page from RN Clarke. She's under disciplinary review for exceeding her scope. All consults for her patients go through me first. Pierce. It wasn't a request. It was a command that had been transmitted down the chain like a blade through soft tissue. Hannah read it standing at the supply cart, her hands full of cardiac monitoring cables and fur tubing. Tommy was 2 feet away, restocking the crash cart. He saw her read the message. He saw her expression not change. That was the remarkable part, that her face remained absolutely still while something like mercury moved through her bloodstream. "He just killed that patient," Tommy said quietly. "He doesn't know that yet," Hannah replied. At 4:06 a.m., the monitors began their escalating alarm sequence. The John Doe's heart was working harder, racing faster, becoming less effective with every beat. His systolic pressure had dropped to 72. The alarm chirped and chirped and chirped. Hannah was at the bedside before the attending surgeon made it out of the break room. She was checking the neck veins when Dr. Pierce appeared, moving with the confident stride of a man who believed that everyone else was too incompetent to understand what was actually happening. "He's in tamponade," Hannah said. "Pericardiocentesis. He needs it." "The echo was clear," Pierce said. "The echo was this morning. It's been 9 hours. Fluid reaccumulates." Her voice was still level. Still professional. Still contained. But something had shifted in the way she stood, in the angle of her shoulders. The way her eyes held his without flinching. His decompensating. "Look at the pressure. Look at the heart rate. Look at his JVD." Pierce looked at the monitors like they might be lying to him. Like a bunch of machines with no medical degree might have gotten it wrong. "Continued observation," he said. He turned to walk away. That was when the attending surgeon, a woman named Chen who'd been working the ER for 13 years and had developed the ability to smell a disaster before it happened, put a hand on Pierce's arm. "The consult call to cardiothoracic," Chen said carefully. "Why wasn't it processed?" "The patient doesn't meet criteria," Pierce said. "That's not your decision. That's cardiothoracic's decision." What happened next happened in the way that some moments in hospitals happen, the way they fracture into pieces that take years to fully understand. The John Doe's monitor began its dying song. The heart rate dropped. The blood pressure bottomed out like a stone falling down a well. The rhythm broke into something called pulseless electrical activity, which was a medical way of saying his heart was still trying to fire its signals but nothing was happening anymore. His body was already writing its own epilogue. Dr. Pierce was still explaining clinical judgment when Hannah moved. She wasn't thinking about scope of practice or disciplinary files or the fact that she'd already said more words of protest than any wise person would have permitted. She was thinking about the John Doe who had likely been somebody's father. Somebody's brother. Somebody who had been alive and driving on I-40 at 2:11 a.m. for reasons that mattered to him, and now he was going to die because a cardiologist didn't believe his own patient. "Get me a 19-gauge angiocath," she said to the nurse next to her. "What?" the nurse said. "Right now." "Syringe." "Alcohol prep." She was already moving to the bedside, already locating the anatomical landmarks by feel, the fourth intercostal space, left anterior axillary line. The place where a needle could go between the ribs and reach the pericardium. The place where a needle could release the pressure that was suffocating the heart from the outside. Dr. Pierce was saying something. His words came from very far away, like he was shouting from another room. Hannah wasn't listening anymore. The noise had stopped having meaning. What mattered was the patient. What mattered was the window that was closing with every second that ticked past on the monitors. What mattered was the fact that this man was going to die if someone didn't do something in the next moment. The needle went in smooth. The hiss of air escaping from the pericardium sounded like a sigh of relief. The pressure released. The blood pressure began its slow climb back from the basement where it had gone. Dr. Pierce's face went through a transformation that would have been remarkable to observe if anyone had been watching him. Which they weren't. They were all watching Hannah, watching her hands, watching the way she had moved from nurse to something else entirely in the space between one heartbeat and another. The monitors screamed at 2:06 a.m. on hour 48. Hannah was alone with the John Doe when the rhythm broke, a flutter, then the flat line that makes every nurse's chest tighten. No warning. No deterioration she'd missed. Just the sudden violence of a heart deciding to stop. She hit the code button without hesitation, her palm striking it like she'd struck alarm panels in dusty aid stations 1,000 kilometers away. The intercom crackled overhead. Code blue, Trauma Bay 3. All hands. She was already moving into position as the monitors wailed. Gloved hands on his sternum. Compressions at 110 per minute, the rhythm embedded so deep in muscle memory that her body didn't need her brain's permission. 1, 2, 3. Push hard, push fast. The crash cart squeaked against the tile as she dragged it closer with her hip, still maintaining rhythm. 30 compressions. Check pulse. Nothing. The room filled with motion as the code team poured in nurses, residents, a respiratory therapist with the crash bag already open. How long? Someone called. Monitors alarmed at 2:38. Hannah said, not breaking rhythm. I was with him. Dr. Pierce arrived in his white coat like an admiral boarding a ship, command settling over him immediately. He took position at the head of the bed, scanning the monitors with practiced eyes. Continue compressions. Push one of epi. A resident scrambled to draw up the medication. Let's get the Defi pads on him. 200 joules on my mark. Hannah's compressions continued, each push driving blood through arteries that were already failing. The epi went in. They shocked the chest. The body arched against the paddles. The line remained flat. Another round of compressions. Another dose of epinephrine. The ventilator wheezed its mechanical rhythm, pushing oxygen into lungs that couldn't process it anymore. 5 minutes. 10 minutes. 15. The cardiothoracic surgeon was across town. 23 minutes minimum from here if the traffic gods cooperated. They wouldn't. Hannah felt it before she saw it on the monitor, the way the patient's chest wasn't rising properly, the dullness when she pressed, the absence of the resistance that meant air was moving through tissue. Cardiac tamponade again. She'd seen this presentation 48 hours earlier, before Pierce had shut down the consult, before this ranger had coded once already at her hands. The pericardium was full of blood. The heart was drowning in its own fluid while they were standing here pushing epi and hoping for a miracle. She didn't ask permission. Her left hand never stopped compressions as her right found the scalpel on the crash cart, not the small one for minor procedures, but the one with the blade long enough to matter, the kind she'd used in the back of a Humvee outside Tikrit while rounds punched through canvas and a CIA asset bled out faster than any human being should be able to bleed. The muscle memory wasn't just in her hands. It was in her spine. It was in the steady line of her shoulders. What are you doing? Pierce's voice cut like a scalpel itself. Hannah didn't answer. The blade found the space between the 5th and 6th ribs, the lateral approach, the line she'd drawn in her mind 100 times. One incision. The chest cavity opened with the soft resistance of tissue giving way to necessity. Her hand was already moving, already inside, her fingers finding the pericardial sac, feeling for the adhesions, for the blood that was stopping the heart from beating. The room went silent except for the monitors and the ventilator and the sound of her breathing, controlled, measured, the breathing of someone who had done this in conditions that would have made civilian surgeons weep. Get the pericardium, she said to no one specific, to everyone. Clamp it. A resident moved on instinct, muscle memory responding to command voice the way bodies always do. The clamp slid into position. Hannah's other hand found the heart, the massive muscle that was supposed to be invincible, supposed to be pumping a warrior through ambushes and airborne insertions and extraction missions. It was still. It was dying. She began manual cardiac massage, her palm against the ventricle, compressions from inside the chest cavity where she could feel the resistance, the recoil, the way the heart wanted to live if someone would just show it how. Squeeze. Release. Squeeze. Release. The rhythm of resuscitation, the rhythm she'd learned in a classroom in Fort Benning and perfected in a forward operating base in a desert country whose name she was never supposed to mention in civilian spaces. The monitors blipped. Once. Twice. A hesitation. Then the line began to move, not the flat line of death, but the irregular bumping of a heart remembering how to work. The bumps became waves. The waves became rhythm. Regular sinus rhythm. Blood pressure climbing. Oxygen saturation crawling up the monitor like a soldier climbing a rope. 78, 82, 87, 91. His got output, the resident breathed. The cardiothoracic surgeon burst through the doors 30 seconds later, his face a mask of controlled anger that transformed instantly to something else, professional disbelief mixed with professional respect, the look a specialist gets when they're standing in front of a field procedure that belongs in a combat hospital, not a trauma bay in Raleigh. Hannah stepped back. She kept her hands steady as she removed them from the chest cavity, kept her breathing even as she held pressure on the surgical site. Her scrubs were painted crimson to the elbows. The surgeon moved in, assessed the work with a surgeon's eye, and nodded once, a gesture so small it could have meant anything. It meant everything. Dr. Pierce's voice came from the corner, sharp enough to cut. Security. Now. She'd just performed surgery. A nurse just performed surgery. Hannah still didn't look at him. She maintained pressure until the cardiothoracic surgeon had his hands positioned, until the transfer of care was complete. Only then did she step away from the patient, only then did she pull off her gloves and watch them fall into the biohazard container with the soft whisper of latex yielding to gravity. Pierce was already on his tablet, his fingers moving with the precision of a man building a case. He read the words as he typed them, as if speaking them into evidence would make them more real. Section 7.3 of the Nursing Practice Act. Gross violation of scope of practice. Emergency license suspension. I'm also filing with the State Board, the Joint Commission, and Hospital Risk Management. A resident, the same one who'd handed him the clamp, started to speak. Pierce held up one hand without looking away from his tablet. The resident closed his mouth. Security arrived within 8 minutes. 2 officers in Navy uniforms with the look of men who'd learned not to ask questions about paperwork they didn't understand. They knew their job. Escort the suspended employee off hospital grounds. Preserve patient privacy. Don't engage in conversation. Hannah walked ahead of them toward her locker, toward the employee lockers in the basement where she'd been storing her life in compartments for 6 months. She packed methodically. The cracked mug that said "World's Okayest Nurse," a gift from a rotation she'd spent in pediatrics before everything went wrong. A dying succulent that she'd tried and failed to resurrect. Some things couldn't come back from the edge of death, and some things shouldn't have to try. A photograph, faded at the edges from being carried in field pockets and base office drawers, showing her Ranger unit assembled in formation before a mission that had been classified so deep that her official discharge paperwork claimed she'd injured her leg during a training exercise in 2019. Captain Hannah Clarke. Officially erased. The cardboard box felt light in her hands. Everything she'd kept from her civilian life fit into 4 by 6 by 10 inches of ordinary brown cardboard. She carried it through the parking lot at 3:52 a.m. while the rain came down like applause, like the sky was celebrating or mocking, she couldn't decide which. The cardboard darkened. The photograph inside curled at the edges. The water pooled around her boots, the same combat boots that lived in her car because she couldn't quite bring herself to wear them into the hospital, couldn't quite commit to being seen. She stood at the bus stop and wondered if disappearing twice was some kind of record. The first time had been official, sanctioned, buried under redacted documents and Section 5 classifications. The second time was happening in real time, in the rain, in the ordinary darkness of a city that didn't know it had just fired the person who'd held together the fractured insides of 7 different men under direct enemy fire. The bus pulled up at 11 a.m. She got on. Nobody looked at her. Nobody ever did. But something was moving in the hospital basement at that same moment, something that would change the mathematics of her invisibility forever. Rain hammered the parking lot like applause for a performance nobody wanted to see. Hannah sat on the bus stop bench, cardboard box balanced on her lap, its edges already softening in the downpour. Inside, a cracked mug that said "World's Okayest Nurse," a dying succulent with leaves the color of dried blood, and a photograph. 5 women in desert camo, faces burned dark by Tikrit sun, standing in front of a Humvee with the 75th Ranger Regiment patch visible on the vehicle door. Her unit. Before the CIA asset extraction. Before the operation got buried so deep that Captain Hannah Clarke stopped existing on any official record except the ones marked classified and filed in a Pentagon basement. She stared at the photo for maybe 2 minutes, maybe longer. Time moved differently now, then slid it back into the box. The succulent would be dead by morning. Some things couldn't survive the transition from one life to another. The bus didn't come for 47 minutes. She didn't count them. She just sat there, soaked through her civilian clothes, watching headlights blur in the rain. But something was moving through downtown Raleigh at that same moment, something that would shift the mathematics of her erasure forever. A visiting Iraqi diplomat named Amir al-Rashid had been delivering a speech at the Performing Arts Center about reconstruction efforts in Tikrit when his heart decided it was finished with the job. One moment he was discussing water treatment infrastructure. The next moment he was on the floor, and someone was screaming for an ambulance, and his vision tunneled down to a single point of light before everything went black. 48 minutes later, St. Michael's ER received the incoming trauma alert. Visiting dignitary. Acute MI. ETA for minutes. The staff mobilized like they always did, beds prepared, crash cart positioned, Dr. Pierce already in the hallway barking orders at nurses he'd spent 6 months training to doubt themselves. He didn't see the admission nurse slip out the back entrance of the ER. He didn't know Hannah Clarke was technically still employed until the paperwork fully processed, still had access to the secure corridors, was helping wheel the diplomat's stretcher from the ambulance bay because some things ran deeper than pride or survival instinct. The diplomat's eyes were closed, his skin the color of wet concrete. 2 paramedics were calling vitals, systolic dropping, irregular rhythm, probable anterior wall infarction. They transferred him to the hospital bed with the efficient brutality of people who did this 17 times a night. Hannah's hands moved on their own, inserting the second 4 line, checking pupil response, her touch steady as a surgical laser despite every decision she'd made in the past 4 hours pointing toward obliteration. Then the diplomat's eyes opened. Not all the way. Just enough to focus. Just enough to see her face. His right hand shot out and grabbed her wrist. His grip was weak but his voice was clear, 2 words in Arabic that hung in the trauma bay like a name being called from across a decade, Al-Malik al-Azraq. The Blue Angel. Hannah's pulse didn't quicken. Her expression didn't shift. But something behind her sternum compressed into diamond density because she knew exactly what that call sign meant. It meant a CIA asset extraction in Tikrit. It meant treating wounded insurgents in a forward operating base that didn't officially exist. It meant a young translator who'd watched her work under fire and lived. It meant she'd been recognized. The diplomat held her gaze for 2 more seconds, then his eyes fluttered closed as the cardiac team swarmed in and she stepped back, becoming anonymous again, becoming just the ER nurse, becoming the ghost that no one was looking for anymore. But Tommy Rodriguez had been watching. The old combat medic turned transport driver had seen the diplomat's lips move. Had heard the Arabic. Had watched Hannah's entire body go still for one heartbeat that lasted 1,000 years. And Tommy, who'd spent 18 months in Tikrit himself, who knew what the Blue Angel designation meant in the underground networks of soldiers and translators and people trying to survive, he disappeared into the hospital basement without another word. Dust and old equipment filled the basement corridors. Boxes of patient files marked for destruction, abandoned medical equipment tagged for salvage, the institutional detritus of a hospital that had been running for 43 years. Tommy moved through it like he knew exactly where he was going because he'd watched them take the John Doe's effects down here 2 days ago. Security protocol said the belongings stayed in the ER for 72 hours before processing. Tommy found the box under a shelf marked, pending identification. Inside, a ranger beret, a worn pair of combat boots, tactical pants stained with blood that had turned rust brown in the fluorescent light, and a jacket. The jacket was khaki canvas, the kind issued to soldiers before they got deployed to places where the weather tried to kill them as effectively as the enemy. Tommy opened the jacket lining. Sewn into the seam, so faded you almost missed it, was a unit patch. 75th Ranger Regiment. Dark Horse. Tommy's breath caught because he recognized the emblem and he recognized what it meant. The John Doe wasn't a John Doe. The John Doe was one of Hannah's Rangers. The John Doe was one of theirs. 2 minutes later, Tommy climbed the basement stairs holding the unit patch like evidence at a trial, like a flag surrendered after a battle nobody would ever write in the history books. He found Hannah standing outside the diplomat's ICU room. She wasn't watching through the window. She was just standing there, a ghost in civilian scrubs, watching nothing. When Tommy showed her the patch without saying a word, her jaw tightened. That was all. Just a clench, a 3mm compression of muscle, the kind of reaction that most people wouldn't register. But Tommy had spent 23 years learning to read the body language of soldiers under stress, and he knew what that micro-expression meant. She'd just realized the patient she'd saved, the patient she'd cracked open with a scalpel and her own 2 hands, had been someone from her unit. One of her Rangers. A brother or sister she'd thought was gone, and who would have stayed gone if the car accident hadn't happened. If she hadn't been there. If muscle memory hadn't overridden 6 months of humiliation and institutional erasure. The ICU called a few hours later with an update on the diplomat, stable rhythm, medications holding, prognosis improving. His name was Amir al-Rashid and he'd been a translator in Tikrit, the young man who'd watched the Blue Angel move through a forward base with a wounded American soldier on one side and a wounded Iraqi civilian on the other, treating both like they mattered equally, treating both like they were worth saving. He'd told that story to his family for 12 years. He'd never expected to see her again. Colonel Martinez from Reed Army Medical Center arrived at St. Michael's at 9:13 p.m., badge clipped to his uniform, bearing the weight of someone who'd been making notifications to next of kin since 2003. He was there to identify the John Doe, to bring closure to a missing person case that had been open for 17 days. The hospital administrator met him in the hallway outside the ICU. By 10:15, they'd pulled the body out of recovery and confirmed the match. Sergeant James Ramos, assigned to 3rd Battalion, 5th Marines, Dark Horse Company, missing since a vehicle rollover on Route 54 outside Raleigh. Except Ramos wasn't dead. Ramos was sedated in Bay 3, cardiac function stable, lungs inflating on schedule with the ventilator, sinus rhythm holding steady because a nurse who was technically no longer employed had remembered how to fight when it mattered. Colonel Martinez pulled up the citation on his phone. His voice was deliberate, careful, the tone of someone reading words that had been classified and unclassified and reclassified again. Captain Hannah Clarke operated on my forward team in Tikrit, receiving the Silver Star for extraordinary heroism under enemy fire. She extracted a designated asset while maintaining tactical security and providing medical intervention to 4 coalition personnel and 3 civilian casualties. Her actions resulted in 0 personnel loss and successful completion of operation. He stopped. He didn't need to finish. The words were enough. Dr. Pierce stepped out of the shadows of the hallway where he'd been listening. His voice had the texture of someone watching his narrative collapse in real time. That's impossible. I've seen her credentials. She's a registered nurse with no military background. I have documentation of her reckless behavior, her exceeding scope of practice, her dangerous presumptions about clinical authority. I have it all documented in her personnel file. That was when the 2 men in dark suits emerged from the stairwell. Federal agents Chen and Morrison, FBI credentials displayed with the casual authority of people who'd been waiting for this exact moment. Chen was holding a laptop. On the screen, hospital database logs showing 3 separate attempts to access military personnel records through a Department of Defense portal using stolen administrator credentials. Forged incident reports with backdated timestamps. Access logs showing Dr. Pierce had tried to breach the classified credentialing database 7 times in the past 96 hours. The second agent, Morrison, held up a folder thick enough to contain someone's entire institutional downfall. Dr. James Pierce, you're under federal investigation for unauthorized access to classified military personnel records, forgery of institutional documents, and persecution of a protected intelligence asset, Agent Chen said, reading from the warrant like she'd done this 1,000 times. You have the right to remain silent. The handcuffs went on soft and efficient. Pierce's hands didn't resist. His eyes found the empty hallway behind them, as if he was looking for someone to confirm that this was actually happening, that his 6 months of methodical destruction had somehow ended with him being escorted out of the hospital by federal law enforcement while a nurse who'd been erased by the Pentagon turned out to be the actual architect of his demolition. They walked him through the ER at shift change. Maximum witnesses. Staff members he'd weaponized against Hannah watched in silence as he passed, his white coat rumpled, his stethoscope dragging on the tile floor, his world compressing down to the size of a holding cell. Nobody spoke. Nobody moved. The fluorescent lights buzzed their mechanical song, indifferent to human consequence. Hannah wasn't there to see it. She was sitting in a conference room on the 3rd floor with Colonel Martinez and a military liaison named Captain Sarah Holloway, discussing a position at Reed Army Medical Center's VA hospital. The paperwork would take 6 weeks. Her license would be cleared within 48 hours. Her rank would be reinstated retroactively. Sergeant Ramos would survive, would recover, would know that the woman who'd saved his life was the legend he'd heard stories about in the desert, the Blue Angel who treated everyone the same, who gave everything the same. 6 months later, she stood in front of a window overlooking the physical therapy ward at Reed Army Medical Center. The faded unit patch was framed on her office wall next to the military ID she could finally carry again. The ID showed her actual name, actual rank, actual history. Captain Hannah Clarke. 3 tours. 2 Purple Hearts. Silver Star. Everything that had been stolen and buried and erased was suddenly back, displayed in glass like a resurrection. Sergeant Ramos was learning to walk again. His left leg was weaker than the right, nerve damage from the impact, the surgeon said, but his determination was the kind that comes from understanding your own mortality and choosing to refuse it anyway. Hannah stood beside his walker, hands ready but not touching, letting him find his own balance. Slow steps. You're not rushing anywhere, Sergeant. I wanted to thank you again for. Don't, Hannah said, her voice dropping into the register she'd reclaimed from the desert. You thank me by walking. You thank me by getting back to your family. That's the deal. Through the window, a medical supply van pulled up to the loading dock. The driver climbed out wearing a company uniform that fit like a suit made from his failure. Hannah recognized him immediately. Dr. Pierce. His medical license permanently revoked, his criminal record making hospital employment impossible, he was making deliveries to the facility where his former victim now worked as an openly decorated captain. Their eyes met through the glass. For one moment, Hannah gave him the same cold, flat stare she'd perfected during his 6-month campaign, the look that said I survived worse than you could ever inflict, and I'm still here. Then she turned her attention back to Sergeant Ramos, adjusted his walker grip, encouraged his next step. You've got this. Keep going. Pierce finished loading his boxes onto the dolly and drove away. Hannah didn't watch him leave. Some people weren't worth a second glance. Tommy Rodriguez brought her coffee 45 minutes later, and they sat in her office in comfortable silence, listening to the sound of a young ranger learning to live again. On her desk was a plaque, the words from her classified medal ceremony, now finally displayed, "True heroism is what you do when the world stops watching." She'd spent 6 months being erased. She'd spent 48 hours being a ghost. And now she was standing in the light, teaching a soldier to walk, knowing that the most powerful thing she'd ever done was simply refuse to disappear. If you've ever been underestimated by someone who didn't know your true value, if you've ever had to keep your biggest strength hidden just to survive, please like this video and subscribe to see more stories about the warriors walking among us. And comment, would you have revealed yourself when you had the chance, or waited until the moment forced your hand? Let's talk about it.